Your knees hurt. You've stretched your quads. You foam rolled your IT band until you wanted to cry. You've done hamstring stretches, tried knee sleeves, and taken rest days. The pain keeps coming back. And nobody has been able to tell you why, because everybody has been looking at the wrong muscles. There is one small muscle sitting at the back of your knee that is responsible for more cases of persistent, unexplained knee pain than almost any other structure. Most people have never heard of it. Almost no training program addresses it. And when it stops working correctly, every movement that involves bending your knee, squats, lunges, stairs, running, and cycling, loads the joint in a way it was never designed to handle. The muscle is called the popliteus. And here's everything you need to know about it. 1. What the popliteus is and where it sits. The popliteus is a small, flat, triangular muscle located at the back of the knee joint. It runs diagonally across the posterior capsule of the knee, from the lateral femoral condyle, the outer bottom of your thigh bone, down and across to the posterior surface of the tibia. It sits beneath the calf muscles, completely out of sight, and because of that, it is almost completely out of mind. It has no visible bulk. You can't see it contract in a mirror. It doesn't become sore the way your quads or hamstrings do after training. This invisibility is precisely why it gets ignored by athletes, coaches, and most rehabilitation programs that focus on the muscles you can see and feel working. 2. What the popliteus actually does. The popliteus has two primary functions, both of which are critical for proper knee mechanics. The first function is what anatomists call unlocking the knee. When your knee is in full extension, completely straight, the joint locks into a close-packed position, where the femur and tibia screw together for maximum stability. Before you can bend the knee at all, this screw-home mechanism must be reversed. The popliteus is the only muscle responsible for initiating this unlocking. It produces a small internal rotation of the tibia relative to the femur, releasing the close-packed position and allowing flexion to begin. Every squat you do, every step down a staircase, every stride while running, they all begin with the popliteus unlocking the knee. If the popliteus is tight, weak, or inhibited, the knee either can't unlock properly or unlocks with compensatory movement patterns that load the joint incorrectly from the very first degree of flexion. The second function is posterolateral knee stabilization. The popliteus resists excessive external rotation of the tibia and provides dynamic stability to the back of the knee capsule under load. When it becomes dysfunctional, the knee has a tendency to collapse into external tibial rotation during loading, which drives the kneecap laterally and increases patellofemoral compression forces. That compression is one of the most common sources of anterior knee pain. 3. How popliteus dysfunction produces knee pain. When the popliteus is tight or neurologically inhibited, two things happen simultaneously. First, the unlocking mechanism at the start of knee flexion is delayed or incomplete. The knee begins to flex before the tibia has properly derotated, meaning the femur and tibia move in a mechanically suboptimal relationship from the very first degree of movement. Every repetition, every step, every squat rep, loads the cartilage and soft tissue in a slightly incorrect position. Second, without adequate posterolateral control from the popliteus, the tibia drifts into external rotation under load. The patella, which tracks in a groove on the femur, is pulled laterally away from its correct path. The lateral facet of the patella compresses against the femur. The medial retinaculum stretches. The fat pad beneath the kneecap gets pinched. This is patellofemoral pain syndrome. It is the most common knee complaint among active people. And the popliteus is almost never identified as the source. 4. The 60-second test. Here's how to assess whether your popliteus is contributing to your knee pain. Sit on a surface high enough for your legs to hang freely. Cross the affected leg over your opposite knee so your ankle rests on the opposite thigh. Apply gentle pressure with your thumb into the soft tissue at the back of the knee, just medial to the midline. Now slowly flex and extend the knee through the last 30 degrees of its range while maintaining that thumb pressure. If you feel distinct tenderness, restriction, or a sensation of something tightening beneath your thumb during the last few degrees of extension, your popliteus is involved. This is not a diagnostic test for clinical use. It is a simple directional screening test that tells you whether this muscle deserves your attention. In most people with chronic anterior knee pain, the answer is yes. 5. How to fix it. Addressing popliteus dysfunction requires 2 steps. First, release. The popliteus responds well to sustained, gentle pressure combined with active knee movement. Use the position from the test above. Apply thumb or knuckle pressure into the posterior knee and slowly flex and extend the knee through its range for 90 seconds on each side. This combines soft tissue pressure with movement that mobilizes the muscle through its full length. Second, reactivate. Strengthening the popliteus requires loaded internal tibial rotation near the end range of extension. A simple and effective exercise is the single leg standing knee dip. Stand on one leg with the knee slightly bent, deliberately internally rotate the tibia, and slowly flex and extend the knee through the last 30 degrees of movement. Perform 3 sets of 15 slow, controlled repetitions, focusing deliberately on the internal rotation component. Most knee pain is not a structural problem. It is a mechanical problem, the result of a small muscle that nobody told you about silently failing at the back of your knee. Give it 30 days of consistent attention, and most people see a dramatic improvement in symptoms that nothing else has produced. Fitness doesn't need more influencers selling shortcuts, it needs better explanations. If this helped, hit like, subscribe to Iron Monk, and leave a comment. Where does your knee pain show up? Front, side, back, or all 3?